Hello y'all, today we're talking about another drug that I see a lot at my workplace, and that is rosuva. I'm not sure if I'm pronouncing it right, but that's how I'm pronouncing it. Rosuva is a type of heart medication. The active ingredient is rosuvastatin, which is obviously a form of statin. That's the drug class it belongs to. We use this medication to lower cholesterol and therefore decrease the risk of heart attack or stroke. Rosuva is usually prescribed after any kind of cardiovascular event. This is because they are important in what we call primary prevention. This is preventing issues before they've happened. If we know that a patient has had a heart attack or some sort of cardiovascular event, we know they're likely to have it again, become worse down the track. So we want to prevent it from becoming worse. We also prescribe it for people who are at higher risk for developing cardiovascular issues. So if someone has diabetes or something like that, we know that down the track they might have cardiovascular issues, and we're just going to do this to get ahead of the ball. I said before that rosuva belongs to a class of drugs called statins. These are probably the most popular of the cardiovascular drugs, and they inhibit the enzyme HMG-CoA reductase. This is an enzyme that is central in the production of cholesterol. Statins are of a similar structure to this enzyme, and so we're able to compete with the enzyme at the receptor. Importantly, it is involved in the production of cholesterol. So in terms of lowering cholesterol levels, it might be better to use another drug if you already have high cholesterol levels. This is why statins are really good in primary prevention, because they stop your cholesterol levels from rising, but they might not necessarily decrease your cholesterol levels more than they normally do. Mainly, the rosuva will work in the kidneys. This is because in the kidneys is where the body reacts to low cholesterol levels and stimulates LDL, or low density lipoprotein receptors. This is the bad cholesterol. Our kidney and our body exist in a concentration gradient of cholesterol. If there's low levels of cholesterol in the kidney, the body is going to give it cholesterol to absorb. So when our rosuvastatin works in the kidney and lowers the cholesterol levels, our body reacts by sending cholesterol to the kidney to be absorbed. This means that it lowers the cholesterol in the entire body and not just the kidneys. Another advantage of primarily working in the kidneys is that rosuvastatin also starts the production of VLDL. Rosuvastatin is unique among the statins because it's the most potent dose we have available right now, meaning you're really going to get bang for your buck at lower doses. It's also highly hydrophilic. This leads to more uptake by the kidneys, but a lower bioavailability. But crucially, it also means that they are metabolized less by cytochrome P450. Because of this, the drug is going to have less drug-to-drug interactions because they're going to be less metabolized. Rosuva is eliminated through the feces, but a small amount is still eliminated through the urine, so people who have renal impairment should be a little bit careful. There are also a couple of things we need to look out for when people are taking rosuva. In the elderly, there's a higher risk of it leading to muscle diseases, collectively known as myopathies, so the frailty of the patient should be considered. Women who are planning to conceive or are pregnant or breastfeeding should also avoid this medication and any cholesterol-lowering medications because it's important for the feces to have cholesterol to survive. In terms of dosing regimen, people using rosuva to combat high cholesterol need a 5 to 10 milligram dose once daily. This does not need to be taken with food, and with people over the age of 50 with a risk of cardiovascular disease, a dose of 20 milligrams daily is recommended instead. This dosage should be lowered for East Asians actually because the dose is more potent to them. And an abrupt stop of statins might lead to a cardiac event, so we should be careful to pilfer it off. Thank you.